Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome to my channel. As you know, I make videos about simplified medical explanation. I try to give you information about your health conditions, why you get sick and how you can get better. And all information given in this channel is most authentic and latest information which is internationally accepted and directly referenced from the US National Medical Library. So you can trust the information. Today I'm going to talk about vitiligo. Vitiligo and what causes vitiligo, why there are some depigmented patches on the skin of various people which you see. Sometimes the patches have no pigments, sometimes the patches are white, sometimes they are just light skin colored patches. But what is the reason behind all these patches? What is the cause? Are there any diseases which are associated with them? Are there any symptoms? And what is the treatment? Is there any test? And what can you do about it? So let's understand vitiligo today. Let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, vitiligo is a skin condition in which there is a loss of color from the area of a skin. So the pigment is decreased or lost. This results in an uneven white color patch that has no pigment. But the skin above feels normal. It feels normal except the color is lost. So what is the reason why this has happened? The vitiligo seems to occur when the immune cells, your own body's immune cells, destroy the cells that make this pigment, brown pigment, called as melanocytes. Melanocytes are present in all the skin cells and they produce this brown pigment. So because of this destruction, because of an autoimmune problem, autoimmunity means the body produces antibodies against some invading bacteria, virus or microbe, and these antibodies actually attack some healthy tissue of your body, thinking that it is a foreign body, because the structure of this healthy tissue is similar to that particular microorganism. So the problem is autoimmune. Vitiligo may appear at any age, and there is an increased rate of this condition in some families. So it can be associated familial, that genetic predisposition is there. It is also commonly associated with other autoimmune diseases, other immunity related diseases like Addison's disease, thyroid disease, pernicious anemia, and even diabetes. So if you have diabetes, thyroid disease, it's more likely that because of that autoimmune disease predisposition, you might even have vitiligo sometime in your life. Now, what are the symptoms? Symptoms of vitiligo include flat areas of normal feeling skin without any pigments which appear suddenly or sometimes gradually over a period of time. These areas have a darker border. The edges are well marked, but the edges are irregular. Vitiligo most often affects the face, the elbows, the knees, back of the hand, feet, and genitalia. It affects both sides of the body equally. Vitiligo is more noticeable in darker skin people because of the contrast of white patches against the dark skin. And no other skin changes actually occur, no other changes occur, no other problem occurs. But obviously, such kind of depigmented skin has a devastating effect sometimes to the patient's mind and life. So how can you diagnose this problem? Generally, just looking an examination of the skin can confirm the diagnosis, but the doctor can use a wood light. This is basically a handheld ultraviolet light that causes the area of the skin with less pigment to glow bright white. So that can be used. Sometimes a skin biopsy can be taken to actually rule out any other cause of pigment loss. Some blood tests can also be done to check thyroid levels, other hormone levels, sugar glucose levels, and vitamin B12 levels. So all these things are done to actually find out whether other autoimmune diseases are also present in the patient. Now remember, this vitiligo is a difficult thing to treat. If treatment is started very early, then there is a good possibility of better results. So early treatment options include a phototherapy, which is a medical procedure in which your skin is carefully exposed to ultraviolet light. Phototherapy may be given alone or after you take a drug that makes your skin more sensitive to light. And this is done only by a dermatologist, skin specialist. Certain lasers may even help the skin to repigment. Then there are some medicines which can be applied on the skin, such as corticosteroid creams or ointments. Some immunosuppressant creams or ointments can be used, and something like tacrolimus or pamicrolimus, and then topical drugs such as methoxyline may also help sometimes. But if it is bothering you too much, skin may be moved from a normal pigmented area and placed onto the area where there is pigment loss. A graft can be done. Plus, there are several cover-up makeups or skin dyes which can actually mask the vitiligo. So you can talk to your doctor about these products also. In very extreme cases where most of the body is affected, the remaining skin that still has pigment may be depigmented, and this is a permanent change that is used as a last option. So it is very important for you to remember that skin without pigment is at a greater risk for sun damage, because pigment, melanin, melanocytes have a role to play to protect you against the UV rays. So you have to be sure to apply a broad spectrum UVA and UVB high SPF sunscreen or sunblock every time you go out, and reapply it every 2 hours. Sunscreen can also be helpful in making the condition less noticeable, because the unaffected skin will not get darkened because of the sun. So the contrast effect will decrease. So use safeguard against sun exposure. Wear a hat or a broad rim or a long sleeve shirt or pants. So all these things are something which you can do. So if you talk about what is a prognosis, it is very unpredictable. Sometimes some areas of the skin may even regain pigment, the color, without even treatments, but other new areas pigment loss may occur. So skin that is repigmented may be slightly lighter or darker than the surrounding skin, and pigment loss may even get worse over time. But unfortunately, there is no permanent cure for this condition because it is an autoimmune disorder. You have to understand, no supplement, no single product from any field can actually treat it completely. So I hope I have given a good information for you on this video, and if you like the video, do share this video. And those who don't know me, I am a consultant physician cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and this is my channel. And you can check out my channel for other such informative videos. These are the authentic and most trusted, most acceptable information from overall the world. So don't forget to share these videos and subscribe my channel and hit the bell icon. Till next time, stay connected, stay healthy. There are so many videos for you to find. क्या हुआ? So you have to be sure. You बोल आजा. So the contrast will look better. So the contrast effect will decrease. Discharge हो गया patient?
हाँ दोनों का
Addison's disease, where your ultimately, but may also help, where your adrenal gland, forget about this,